Good evening, everyone. Thank you for coming back again tonight. It's such a pleasure to have you all and to have you join me in this community as we get to learn more about ourselves and get prepared for pregnancy to have a healthy pregnancy and healthy outcome. My name is Carolyn Curtis. I'm the founder and CEO of the Carib Company, and I have had a good time doing live events since July 9th around the issue of maternal mortality. My concern is for women of color, and in particular, Black women are dying at more than two times the rate of white women in the United States. It is actually seen as a big problem and dilemma. Other countries are looking at us. And so we need to, as individuals, take upon ourselves to know ourselves, know our risk factors, begin to understand the healthcare system, and be empowered to take more control of informed decisions that are being made during pregnancy, the birth process. We are now talking about pregnancy. Last night we talked about signs of pregnancy, and tonight what we're going to do is look at what are the changes that happen in a woman's body when she becomes pregnant. There are lots of changes that go on over this 9-month period, and as a part of those changes, women will experience what we call complaints. And it's good to know what is the normal stuff to expect and understand why those complaints will occur. And then it's going to be important to know that when they're no longer just normal, that they're moving into the danger zone. And we'll talk about that at another time. So let's get right into it. I'm going to share my screen because I really wanted you to be able to see the anatomy. What does a woman's body look like prior to pregnancy? And then what does it look like as this pregnancy has progressed to full term? So give me a second, let me share the screen, and then we'll be able to move forward with the conversation. Hold for 1 second, please. Oh, wow. Okay. Here we go. So on the left-hand side, and hopefully I can use my cursor to point things out. This is what it looks like, just your normal body, okay? I want to point out where your lungs are, okay? Your lungs are up here. Your stomach is here. These are the intestines. This is the uterus, and the opening of the uterus is what's called the cervix. That's what's going to open up when you go into labor. Look at where the rectum is in comparison to where the uterus is, and look at where the bladder is. It sits right underneath of the uterus, and the rectum is right behind. You have, again, your intestines. This is your stomach is here. Your lungs are up here. Of course, your breasts, all right? These are the main organs that I want you to be familiar with. Now, let's look at the right side. Do you see any difference? I think there's a difference. You'll see the lungs are pushed up. The stomach is pushed up. The intestines are pushed up. This is the afterbirth. The baby, this is inside of the uterus. This is what the uterus looked like before. Look at what it looks like now. Wow. The cervix is the opening to the uterus. You see that here? Look at it here. Notice that there is what's called a mucus plug. And when you learn about labor, you will learn about that mucus plug, okay? It's what's plugging and kind of keeping bacteria and all that out. The amniotic fluid and the bag of waters, that is sterile. Until it's broken, it's sterile. So your baby is in a sterile environment. Now, look at the rectum. Look at it compared to here. Look at it here. It's a little squished. and look at this bladder. Oh my goodness. Look at what it was like that here and look at it now. So, what I want to do is to walk through different things happening in terms of common complaints. As you progress in your pregnancy, what you will start to experience, you may and may not. But if you do, I want you to know that these complaints are normal. So if you look at the stomach, I'm going to work kind of from the top down. That makes more sense. As you can see, the stomach is pushed up. The hormones also, the progesterone and estrogen, do changes within your body. It will cause the esophagus is the tube that goes from your throat down to the stomach, and also that will get opened up. The top of it there's a muscle that closes the esophagus so that food does not come back up once you've eaten. And so what will happen is that muscle is relaxed just a bit, but it's relaxed enough that you will get some of the gastric juices. Oh, excuse me for a minute, please. I'm sorry. Excuse me. I live in Washington, D.C., and I heard just a little disturbance outside my door, but I'm back. Um, if you look where the intestines are, so what will happen? Let's go back to the stomach. So you can get what's called a gastric reflux, where there's like gas, or gastric reflux, where you're feeling like you're tasting what was in your throat. I mean, in your stomach, in your throat. And that's because there are those acids that are coming up through that esophagus, that little muscle called the pyloric muscle. What you can do for that is it's possible to take antacids. Also, you want to make sure that you're not lying down immediately after you've eaten. You want to wait for at least 30 minutes before you lie down. These things will try and help. You also want to stay away from very greasy foods. This will help to reduce that reflux that you might have. The other is you can see the intestines. Okay, the intestines are all squished. And remember, now your intestines are going to go down towards your rectum for you to be able to move food that you've eaten through your body and out of your body. So as you can see this, then you are going to be more prone for constipation. Again, the hormones will cause the moving of the food to be slowed down just a little bit. And because of the baby's position and putting pressure, that can also make you more prone to having constipation. Over all the years that I have practiced, I have never, ever provided laxatives because you do not need a laxative. You need to drink more water. You need to drink water, eat foods that will help, such as raisins, prunes. These things will help with the constipation. The other thing that you may see or feel, as you can tell here, again, the bladder is right here. The bladder is going to be, as you can see, pressure on the bladder from the baby's head. And pressure on that bladder can cause you to have, the bladder cannot fill up as much. So you will feel the need to go to the bathroom more often. So it's possible, particularly in early pregnancy, you may feel the need to urinate more often, and that will relieve. Now, we're looking at a baby that's more in the 9-month period of time. Things will calm down with that. And then as you get larger and get closer to delivery, you may notice more frequency needing to go to the bathroom more often. That's because your bladder cannot hold as much because the baby is directly above. So you never want to have burning. If you have burning, then that's an indication The other things that we cannot see on this particular slide will be that you do have bands of muscle that attach. I need to bring that up. Maybe I can do that tomorrow. I don't have it available right now. But there are bands of muscle that are kind of in your, what shall I say, down in your inguinal, I'm trying to say down, kind of in your pelvic area. And what they do is they hold the uterus in place and also in the lower back. And as your baby grows, it will put more tension on this muscle. And so there are things that you can do. You might feel some discomfort in the lower area. This nut should not be like abdominal discomfort. I'm talking more muscle lower down. If you have questions, you should always be in touch with your provider. I am not here to provide medical advice. I'm here to give you information. So I'm not here as a provider. I'm here just to provide with information. So always, always, you need to be seen by a medical professional and follow their medical advice. But I'm trying to help you to understand the changes that happen in your body. So these are common complaints. The other is going to be leg cramps. That is very, very normal. Leg cramps is due to the need for more calcium and magnesium in your diet. Babies are going to take the calcium that they need. And if you are not taking in enough calcium, they're going to take what they need. And so you're going to be left with a deficiency. So it's important for you to make sure that you have calcium and magnesium in your diet. Trying to think, again, your breasts are going to enlarge because you are getting ready. Your body is getting you ready for being able to breastfeed your baby. It does not matter the size of your breasts. That does not determine how much milk you can make or whether or not you can breastfeed your baby. The size of your breast does not matter. So I want you to understand that clearly. Trying to think of anything more in regard to common complaints that you can come across. If you have any thoughts, please, I will include my email address. Feel free to contact me that way. So these are common complaints that can occur and the normal changes that happen in your body during pregnancy. So once again, I'm going to come off of sharing. Let me see how I can do that. Okay, I'm back. Thank you again for your time tonight. Tomorrow, I want to talk a little bit about danger signs. So, we talked about normal kinds of things that can happen, but there are points when normal kind of creeps over to where it could be danger signs of things starting to go wrong, such as when your blood pressure is higher than it should be, such as when you have swelling that is more than it should be. You may experience a little swelling that should go down once you elevate your legs, but you should never have swelling in the beginning of the day. When you get up, there should not be swelling. If so, those are things that you would need to contact your medical provider around. So, again, thank you so much for tonight. I hope that you have learned something from the information I have provided to you. Please feel free to tell your friends and family members about this YouTube channel. I hope that you will subscribe so that you can see more things coming up. Another exciting thing to tell you is that I've been out trying to line up some live interviews that I can do so that we can hear from dads, so that we can see the kinds of resources that are in different neighborhoods around the country. Just so that give you more options for your pregnancy and childbirth. Very soon, we're going to move into the question of who are you going to hire to assist you with your care during pregnancy and through the birth process. So thank you again. I look forward to any comments, you liking, subscribing, and sharing. Have a really great night. Take care. Thank you.